All right, folks, we're going to get started here. Pretty short, sweet webinar we put together here today. We just, in lieu of Medicare Advantage and Medicare season open enrollment starting up here, we have we just want to put something together here, kind of talking about some of the Medicare tools that we have. We did have, again, pretty large class here, so we're going to go ahead and just allow you to type questions in below. I'll try to get to those as we go through the presentation. Without much further ado here, I just kind of want to tell you about some of the things that we have available to kind of help you have a better Medicare season. And it's not just season, I guess. We get so wrapped into the open enrollment period that sometimes I think people just overlook the fact that we have nearly 15,000 people entering Medicare every day in this country. 13,000 that are aging in, another 1,000 or so a day that from disability angle, another 1,000 a day that have worked beyond their 65th birthday who are now entering Part B a bit later. So anyways, consequently, you have a lot of folks turning, becoming Medicare eligible every day, and so it's kind of a year-round thing. So I do want to just touch a couple things that we do to kind of help you. The Medicare season is upon us, so some of the tools I'm going to talk about today, Medicare.gov, CSG Actuarial, Medicare Center. And of course, we have some of our carrier-specific Medicare Supplement e-apps that every carrier has their own format, etc. And part of the tool, the CSG Actuarial, is some of the companies are trying to catch all these carriers and put them all in one place, so you don't have to worry about numerous websites, passwords, etc., and different formats for every carrier. I've been finding it a little easier to stay with one electronic or e-app place where I can kind of do all my companies in one place. I find that to be a lot easier. That's a little bit what we're going to talk about today, is just kind of how to use some of these tools that are out there. This webinar is kind of a work in progress. It's just kind of a brainchild of myself, a couple other marketers here that we have some very nice Medicare things that could be used. We just don't see them being utilized that much, so we're hoping the webinar here will speak to some of these things and how to use them. So again, some of the better ones to know of, if you're in the Medicare arena, if you're doing much with Medicare work at all, the Medicare.gov site's a fantastic site, something you should definitely get to know how to use. This is the site that's put out by Medicare. It's just full of a bevy of information and anything that a client would need to know about their own Medicare, whether or not they're signed up for Parts A and Parts B, how to sign up for Part B or Part A, how to research different plans, whether it's Medicare Supplement, Medicare Advantage, Part D plans, how to look up to see, I don't know, if they need to file appeal, they don't feel like their Medicare coverage covered something, or their certain plan didn't cover a health need to their satisfaction. They need to know things like, I don't know, how to get help with prescription drug expenses. Medicare.gov /prescription help / pharmaceutical plans.com. There's just all kinds of stuff on there. I won't touch on all of it, but again, in Medicare.gov, at least for what we use it for, what I use it for, is just to decipher the better drug plans that are available for folks. Then I'll go into CSG Actuarial. This is really a good shopping thing for any zip code you give me in America. I can tell you all the med subs available for plans G, F, H, whatever, what have you. I can tell you all the Medicare Advantage plans available. I can tell you all the Part D drug plans available in any given zip code. And we can research that, kind of help them shop around. Then when we want to enroll, maybe it's a Medicare Supplement. CSG Actuarial has a place to go online, an electronic app that you can do right at CSG. If it's a Medicare Advantage and or a Part D, I switch over to Medicare Center and enter them that way. So again, this is kind of a lot. So a basic slide here, and those of you that have done anything with Medicare and you're currently doing your CMS training, you know that we're not necessarily able to ask any health questions about it. And so people often ask me, what's right for me, a Medicare Supplement or a Medicare Advantage? It's a tough question to answer without asking health questions. Again, CMS and the rules regarding Centers for Medicare Systems are very, very clear about asking a lot of health questions to potential Medicare Advantage enrollees. If it's just general sweeping questions about, what's right for folks, there's a myriad of answers there, but again, without trying to ask specific health questions, like, generally speaking, younger, healthier clients, Medicare Advantage might be better out for them because they don't go to the doctor a whole lot. They have some cost sharing when they actually see the doctor. It's more of a pay-as-you-go type of thing. So if you see a doctor once a year, well, it's going to be a pretty good deal. If you're someone that's in the doctor 5 times a month, you might want to be looking at Medicare Supplement because you're going to need more coverage. And so, but as far as asking health questions, you're not allowed to unless it relies to something, or if you have a chronic condition, end-stage renal disease or chronic bronchitis or chronic emphysema or diabetes with heart trouble, or so there are these special needs plans out there that Medicare Advantage plans address those exact health needs. And so if you're asking about those particular chronic conditions, then you're kind of okay to ask something about those health conditions. But generally speaking, we don't. But just as a general rule, again, when people ask what's better, Med Sup, Med Advantage, they're both good. They both work for a lot of situations. Generally speaking, if people don't doctor much at all, they may be able to save some money in a Medicare Advantage plan. If they're doing a lot of doctoring, then maybe Medicare Supplement. The one thing to keep in mind when you're starting out with someone on Medicare, and this is something that's so important that you understand, is that Medicare Advantage plans have an open enrollment each and every fall, October 15th through December 7th. So people are allowed to then go ahead and switch, keep the existing plan, change a different Medicare Advantage plan, leave their Med Sup, go to a Medicare Advantage plan. There's never any underwriting. Medicare Supplements, however, are medically underwritten once they leave their initial enrollment into Medicare, their open enrollment where they can pick any plan they want. They can get a full coverage Med Sup with no health questions. And so if you decide not to go with a full coverage Med Supplement plan, when you first enroll Medicare, if you ever want to go back to it, you have to be underwritten. So you can't go with a lower cost Medicare Advantage plan, have a stroke 3 years later, and then decide I want to go back to a Medicare Supplement because you'll have to be underwritten, you won't qualify. So the trick is, if you can afford, this is what I tell my clients, if you can afford to have a full coverage Med Sup, go to any doctor you want, no copays, no networks, pretty much, generally speaking, if they accept Medicare, they're going to accept the Medicare Supplement. Then you can afford the premium, go ahead and go with the Med Sup. It's not going to take food off your table. It's a safe play. You can always switch back to Medicare Advantage plan. Over time, your Medicare Supplement premiums will go up. By the time you reach the age of 80 or 85, sometimes those premiums get to be $200, $300, $400 a month. Well, at that point, maybe you do look at an Advantage plan. If it has a max amount of pocket of $3,000, you're already spending $4,000 in premium. Well, you have nothing to lose at that point. And so those are kind of things that we look at. So how do I decipher, which plans are right, or how do we? So I'm just going to take this as something that I do when I sell, when I'm working with folks. I want to try to find them the best coverage. Without asking them a ton of health questions, I more or less just ask them, are you someone that's in the doctor all the time? Are you someone that never sees the doctor type thing? So the one thing you'll have to kind of do no matter what is understand they're going to be enrolled in Parts A and Parts B of Medicare. Sometimes people think their Medicare, they realize their Medicare coverage is starting, and they're just not sure. They're retiring maybe from their employer plan. They're 67 years old. They've got plan. They think they have Part A. They don't know if they've signed up for Part B, or they are aging in at 65. And if they're not currently taking a Social Security draw or a railroad retirement draw, they're not automatically enrolled in Part B. Part A kind of happens, you still have to sign up for it, but that's always going to be the effective date of your 65th birthday or your birth month. But so I tell people to go to Medicare.gov, see if you are indeed enrolled in Parts A and B. They enter their own information. They can find that out, or they can simply call the Medicare number, which I tell them to do to make sure, 800-772-1213. That's kind of a number that you should get to know. It's a popular number. It just lets, they're going to tell you if you're enrolled in Parts A and Parts B, what your effective dates are, and so you have that squared away. And so let me just take a quick look at Medicare.gov here. I'll show you kind of how, without going into a lot of detail to do it, we're going to just basically do. So what I do when I'm helping folks is, I'm not going to actually sign them up for Part A or Part B. That's between them and the state. But, they may have, they want to know what kind of prescription drug plan they should be looking at. Say they are going to go with a full coverage Medicare Supplement plan with, I don't know, Aetna or Mutual of Omaha. And they're really curious about, what drugs they should be taking or what plan would be right based on the drugs they have. Well, what I will do then is I will take them to Medicare.gov. And so when you go on to Medicare.gov, this is the home screen. Okay, they changed it just recently, like in the last week here. This is a new little format they have out here, so I'm just going to go in here, find a drug or health plan. Okay, then I'm going to put a zip code out here. I'll just put 17112. Okay, and then I'm going to put find plans. Okay, so they're going to ask you, you have original Medicare? Yes. Do you get any help with your prescription drugs, like from Medicaid or anything else? And this thing I'm just going to put, I don't get any extra help. Would you like to add drugs? Yes. So I'm in here. I'm trying to look for the drug plan, sir. So I'm going to put yes here. Some original Medicare. Might be buying Med Sup. Just trying to figure out what drug coverage I need. So I don't get any extra help. I want to see the drug plans. So I'm going to hit those three and continue. At this point, it's going to ask me to enter my drugs. So I'm just going to make some up here. Let's just say, I don't know, this 65-year-old female, she's I don't know, she's on a water pill, so she's on furosemide. So I'll go ahead and put that in there. Furosemide, she might be taking 20 milligrams once per day, so 30 per month, one every month. I get this at the retail pharmacy. I add that to my drug plan. And maybe she's also taking, I don't know, we'll just say Premarin for estrogen loss. Okay. So we'll put Premarin in here. All right. And it's going to ask us what dosage. Maybe they'll tell you I'm taking 0.45 milligrams, and I take that once a day. So 30 once a month, perfect. I get this. Now you do have the option here, if you're someone that the client likes to get mail order drugs, well then you'd say I get 90 every 3 months, and I use the mail. All right, I go here, I'd say I get this one for the mail order. For now I'm going to keep them all with retail, so I'm just going to do retail pharmacy, once a month, 30, okay, add this one. Let's just add a couple more here. We'll just say this person is on, let's see, maybe they're on a thyroid medication, so we'll put thyroid. Usually call it someone else. Synthroid, that's what you should call it, Synthroid. Okay, so I'll put Synthroid. I'm on, I don't know, 100 milligrams, 30, one every 2 months. Again, you check your dosage here. Nice thing is here is that they're going to have every single pill known to man in here, so you'll be able to find a particular drug they're taking. If you can't find it in here, it's probably not going to be on any company's formulary or any company's drug plan, some of these off-the-wall ones. Like, for example, Armour Thyroid, which is, the actual, it's a little more expensive. It comes from actually, pigs, but that one's not on any thing. It's a specialty drug that you can't get there. So if I'm going to put Synthroid in here, frequency once a month, I get this from retail, I'll add that one. Now, here's what comes up once in a while. It's saying there is a lower cost than Synthroid. It's called Levox, I can never pronounce these, levothyroxine sodium. I'm going to say, yeah, you know what, I would like the generic equivalent. So I'm going to go ahead and use that. Okay, so it's going to change that for you. And you can change it back if you want. So right now I've got right here, yes, entered Synthroid, but I went ahead and went with the lower, the Levoxram. Okay, so let's add one more here. Let's just go with, let's go with Lipitor, glycerol. Okay, it's going to ask me the amount of 20 milligrams once a day. All right, so I'm going to add that. Here again, they're going to ask me, and I do strongly suggest you do this, atropine calcium. Use the generic equivalents whenever possible. Not going too deep into it. Sometimes the generic equivalent doesn't work for folks. It does happen. More times than not, it does. And using these drug plans, if you were to try the more expensive brand name or the cheaper generic one, it doesn't work for you. And basically, because it doesn't work for you, you tried it, you did it for 2 months, then they try to prescribe the more expensive, and so the generic didn't work for you. The company typically has to charge you or has to cover the brand name drug at the lower rate because you did try the lower one to begin with. It's called step therapy. It has to do with your Medicare plans, but if you can get people on the generic ones, that's what they want to do. It saves them money. Okay, so I'm going to continue, and I'm just going to say my drug list is complete. Now it's going to ask you to pick a pharmacy. Maybe, I don't know, maybe go to CVS, and you go to, this particular zip code is in Pennsylvania, so I'm going to go with CVS and Giant, are the two I'm going to pick. So I'll pick that one. And Giant, those are two big pharmacies out there. All right, so I picked a couple of pharmacies. Now I'm going to continue the plan results. And from here now, it's going to ask me again, do I want to limit the monthly premium, limit the annual deductible, limit drug cost? I just kind of let them print them all. So I'm only looking at prescription drug plans right now. So I'm going to click that and just go ahead and show results. Okay, so now when I'm with that client, they gave me their 4 drugs. I can kind of tell them now, not a guess here. I mean, I always tell people, look, we don't have to guess at your drug coverage. We can actually tell you what drugs you need based on what you give me here. And so the retail cost of your drugs is going to be $1,500. So with these particular drug plans, as I look at these, okay, based on the meds you gave me, if you went with Silver Script Plus, your cost to retail pharmacy would be $388. Mail order would be $411. That plan costs $59 a month. So if I add up $59 a month, which is $780, then if I wanted to add this, about $1,100 total. So I'm looking at the next one here. This one, $80 a month. Similar co-pays here, so that one's going to be $960 plus that, so that one's about $1,300 total. And so you kind of get the idea here. Now here again, I only have $580. I got $26 a month, so that's going to come out to about $340 plus $580. Now we're only talking about $900. So that plan looks pretty good. Aetna's RX Select. See, this one come up a lot. $1,720. So that times 12 is, what's that going to be? About $210 plus 5. So that's even lower yet. So for this particular person, I might suggest the Aetna RX Select. Mutual Omaha is brand new to the market, so they don't have the star ratings. You'll notice here they have the overall ratings of the plan, 3 to 5 stars. I typically like to see plans that have been around longer than a year. And so since this is kind of a wash, you know, doing this for a while, I know that certain carriers, they'll have an X amount or a limit to how many drugs you can get at X amount of cost. So I do see that in some of the mutual plans, you read the fine print. But so this is how I determine for folks, you know, what drug plan is best to use. Okay, I'm not using West. This plan should work out pretty good at you. Basically, you go to that. Now you can go back and rerun these things. That's why I try to be as most accurate as I can for folks. But if I wanted to, I can go back here and say, you know, actually I do like. Okay, so maybe I do want to maybe just do a. Maybe I do mail order instead. Okay, so I would go back to the very beginning there, and I would put them in as mail order, and I could recompute again. I don't want to spend a lot of time on this, folks, but get to know this site. This is how you find drug plans. Play around with it. One thing I can tell you is after you enter your drug, especially if it's like 15 drugs, and it took a while to enter them, jot this down in a notebook or on your client's file, this drug ID list. Once I write this down, I can go look at five different people. And it seems like what happens when you have someone with 12, they'll call you back and say, well, I'm not taking that one anymore. Now I'm taking this one. Well, I can just put that drug ID down and the password, and they'll bring me back to their original list, so I just can just change one. So, you know, that does help a lot with re-entering them. So that's Medicare.gov. A lot of things they can do. They can look up their own Medicare information, whether they have Part A and Part B. You can see if they, again, if they qualify for any subsidies, if they want to look anything up. Mainly if I just want to look at drug plans or even the health plans. But I have a better place, I think, to look up for the health plans. I think is a little easier. I use this mainly for the drugs. But if I wanted to go on to, let's see, where's my next slide in the PowerPoint here. So next would be Medicare.gov. Well, the next one would be the, now we have CSG and Medicare Center, these two plans here. And you can have access to either one of these tools here on our website, GoldenCareAgent.com. You'll see under Tools, you'll see CSG Actuarial and Medicare Center. So let me just give you, again, just a brief overview of how to use these, and we can kind of wrap up the webinar. But okay, so CSG. I use this tool a lot. You know, this is where I shop. And so let me show you what this looks like. So again, you go to our website, you go under Tools, CSG Actuarial. So I use this probably exclusively to shop plans. So I have that up right here. All right. So when you come up to CSG, you're going to have, you know, this dashboard. And I'm going to look for a Medicare Supplement. Okay, so I'm going to put Medicare Supplement. And I'm just going to go in zip code, what I used before, 17112. I get a female, turning 65. I'm going to look at Plan G. I'm not a big fan of Plan F. It's just not a very good deal for folks. The difference between F and G is, F's going to cover the Part B 185 deductible. Plan G doesn't. And so if there's only the coverage of $185 difference, typically Plan F charges about $400 more in premium to cover the $185. So Plan F's not a very good buy for the customer. Plan G is usually a better buy. Plan F is also going away at the end of this year. I worry about people who buy Plan F. When they don't have any new young blood coming on to help kind of pay premiums, they just have an older, aging block of people at Plan F with no new blood coming on. I feel like those premiums are just more apt to go up, and so I kind of shy away from Plan F. But it doesn't mean, if you're a big fan of it, you can still sell that. I'm just going to look at Plan G. I got the zip code, I got the age, I got a female. So I'm going to go ahead, non-tobacco, I'm going to go ahead and get quote. Now the nice thing is this tool will show me for every zip code in America, every Part D plan, every Medicare Supplement plan, and every Medicare Advantage plan that does business in that zip code. All of them listed with their monthly premium, their rating, name of their company, how many years they've been in business, any discounts they have, policy fees, pretty much anything you need to know about these carriers is there. And so again, now this happens to be a married couple, so let me go over here and put apply the married discounts. Okay, there we go. So if I were telling Mrs. Smith from the Harrisburg, Pennsylvania area, that in my opinion here, here are the rates. So we got Southern Guarantee, it's a B+ rated company. I got Lumico, not a household name, but a big company backed by Swiss Re, good company, but they may be newer in the market, people haven't heard the name. And so what I typically do is I want to find a big, when you're looking at Medicare supplements, remember that Plan G is Plan G no matter who you buy it from, okay? So what I'm looking for in Med Supp is I want a stable, strong company, and I want a good premium rate, okay? And so if I look through here, now I know the top sales in the country, United Healthcare, AARP's endorsement, that's number one in Med Supp sales in the country. Number two is Mutual Omaha. Number three, I believe, is Aetna. The next two or three kind of get a little close. Cigna's in there, Transamerica. A couple of other big companies are going to be in that top five. I try to stay with a big reputable company that's A+ rated. So if I look at these, you'll notice there's not a big difference in price. 92, 94, 96, 96, 96, 97, 97. Again, some of these are just, maybe not huge names, Everest or Union Security or Shenandoah or GPM. I'm looking for a big, there's one, Aetna Continental. Okay, Aetna's, again, number 3, I think, in national sales, so they're $100. And if I'm picking between that or maybe a B+ rated Western, for 30 cents, I'm going with the A-rated stable company that's been in the market for 27 years. Okay, so what else is what you got? Cigna's another big, well-known top 5, top 6 carrier. They're at 104. Here's United Healthcare, number 1 in the nation. Some people love AARP, some people don't. I think we know why, but that's just so. If some people are married to AARP, I'm not going to talk them out of it. Pretty good rate, pretty good company, 105. I represent that company too. So I would tell this person, here's what we got combined, Sentinel. Here's Transamerica, another one in the top 10. Mutual Omaha, where are they at? There they are, 120. So basically for this person, I might come back and say, as far as the good carriers out there, you got Mutual Omaha at 120, you got Transamerica at 112, you've got Cigna at 104, you've got all these companies that are all between, 100, what was Aetna Continental? In this situation, I might lean Aetna, $100 a month, right, right in the nose, $100.08. In other words, I may not go with someone who's $96 or $97. It's just a company I haven't heard of, smaller company. Just people like hearing the name of a big company. And so, it's a nice thing that's going to show you every company in the market. Now, let's say I want to look at Plan F. Okay, let's go up here, and I want to change to Plan F. Okay, so we'll go in here, and I'll take a look at Plan F. Okay, and it's going to load. It's going to show me every company in the zip code for a 65-year-old female, Plan F rates. Boom, there they are. So again, you have a listing of all of them. Ratings. Now, if I want information on that plan, I can get plan details. Med Supps are pretty basic. I think we all understand Med Supps pretty much cover everything, especially Plan F. You pay nothing, right? So that's how Med Supps work. Okay. So what if the person says, I'd like to hear also about Medicare Advantage plans? Okay, well, let's take a look at those. So here I'm going to go to Medicare Advantage and Part D plans. I'll put that same zip code in, 17112. See if I'm boring people. All right. I guess I've actually picked people up. We haven't lost anyone. That's good. Good news. Okay, so if I wanted to find a Medicare Advantage plan for this zip code, I'll just put that zip code in. I want to see the Medicare Advantage plans. Remember, these don't matter about the gender or age. So it's just simply just put a Medicare Advantage for that zip code. Boom, these are 2019 plans. The 2020s will be coming out soon. They're not in here yet, but they're probably going to be out in about a month. But we're talking about the enrollment season. They'll all be in here within the next 2, 3, 4 weeks. So, all right, so let's take a look at the 2019 plans for, okay, now you'll notice here you have 0 premium plans, some that have drug coverage, some that don't. So you're going to have 0 premium with Aetna that actually has drug coverage. You'll find in the Medicare Advantage arena that plans will start a little 0 and they'll go up to what 100 or even more, 120, 130. Okay, and so the Medicare Advantage plans, this one goes as high as 289, 186. I don't know why you'd buy a Medicare Advantage at that price. If I was going to spend over $100, I would just go with that Aetna full coverage Med Sup and never have to worry about a network or a copay and just pay $100 a month. So if I'm going to buy a Medicare Advantage plan, there's really no reason to buy one that's going to be anything over 50, 60, 70 bucks. Right? At that point, you just go with a full coverage Med Sup. But they're here for whatever reason. They're here for folks that maybe did go with a Medicare Advantage plan right away, had a stroke, had cancer, realized they cannot go back to a full coverage Med Sup, so now they're stuck in the Medicare Advantage arena with limits and copays and that kind of stuff. So that's why if you'll notice at the beginning of my seminar, I said, look, if folks can afford $100 to $120 a month for a full coverage Med Sup when they first enter Medicare, jump on the darn thing and don't look back. All right? Just because you can't go back and get it once you have something that happens. Now, again, as you start to age through time, Medicare Advantage, Medicare Supplements premiums will go up, and maybe you always have the option to go over to Medicare Advantage, but you don't necessarily have that option to go back to Med Sup. So I would prefer all the clients that I meet with, if they go Med Sup, I'm happy to help them do that because I know it's not going to be a lot of headaches down the road. But the Medicare Advantage plans are gaining a lot of steam. They put a lot of extra benefits in there, things like dental and vision and these extra benefits, home health care, over-the-counter benefits, nurse lines, just a number of things, the gym memberships, the Silver Sneakers program. They keep kind of sweetening the pot to lure people away from the Medicare supplements. And so, of course, the Medicare supplements are starting to add things to their plans, too. So it's overall a good thing, but each situation is different. And, again, I prefer Med Sup if the clients can afford it and they have to worry about, premiums. But if you have people that are low income, that are, struggling with health costs, and there's a lot of good things about the Medicare Advantage plans. So I can tell you I sell quite a few of each every year. But generally speaking, if they have plenty of money and they can afford it, I try to steer them into that Med Sup to start, and we can talk about Medicare Advantage years down the road or something if their premiums get high. But so I want to look at the Advantage plans. It's going to show me all the different ones here. And so again, this $58 Humana one, max out of pocket at $0. Pretty good deal. It doesn't make any sense actually. It must be a misprint there, but let's just take a look at this. I don't know. Let's look at Humana's $29 one. Also says $0. Here we go. So let's look at Humana's $25 a month PPO plan. So if I have plan details, it'll break me down. Tell me that when I see a primary physician, it's going to be a $10 copay for a specialist. So primary is $10, specialist is $40. Home health care is $0 copay. Out of network for mental is anywhere between $40 and $350 per day. This is going to be for checked into a hospital. Outpatient surgery, $300. So every one of these plans, here's the drug coverage that comes with it. Tier 1 drugs are going to be $3. Tier 2 drugs are going to be $15. Tier 3, $47. Tier 4, $100, and Tier 5, 33%. So you have a nice little snapshot of how each plan works. So you can take a look at any one of them. If I look at Coventry's plan, I get plan detail, same thing. So this is a nice tool, CSG is, because I can get the Medicare Supplement rates, Medicare Advantage rates, and if I want to look at Part Ds, I can also do that. I can go in here and put that same zip code, 17112. I'm going to look at Part D plans. All right, so I get the quote. I just showed you Medicare.gov. So a lot of times what I do is I get a list of this, I show it to them, and people say, you know, I want to see this Envision, WellCare, maybe the Aetna plan. So I'll take those plans they're interested in, you know, and I'll go ahead and run that Medicare.gov report. I don't know if it's still up here. I'm going to expire. So if I still got this plan up here, you know, I'll do this in combination with them. Sometimes they'll join screens. They'll tell them, okay, let's look at the Silver Script plan then. So this Envision RX and this Aetna RX Select $17 and $14. How do they shake out as far as the copays? That's when you can really kind of tie it together and tell them they don't have to guess at this. So that Silver Script plan had a total overall cost of, well, that's not the $59 one. The Silver Script one with the lower premium was, where's that one? That's a little further down. So if I look at this again here, I had this Aetna 1720. This lists them all on premium, you know, from front to back here. So what's the one that was even on there? Envision RX Plus at $14 a month. Mutuals at $26.40. Okay, so here's just two of the first page. So Mutuals was $26.40, and Cigna RX or the Aetna RX Select was $17.20. So going back to our site here, they want to look at those two plans and say, well, how did that work out? The Mutual RX value had 26 premium, but the retail cost when you pick up your prescription, the copays was $580. So I'd take 12 times that and add to that. Then I compare it to, you know, Aetna's. 12 times that and add to that. Well, I can, pretty quick math can tell me that Aetna is going to win by $9 a month, or about $100 less. So I would say if those, between those two plans, I know what plan I want to be the Aetna one. So again, neat tools to use. You got CSG, you can tell me all the plans, take a look at what ones I want. If I need to get a Medicare Supplement, I can look at those. I can look at Medicare Advantage, or I can look at Part D plans. And this gives them a shot of every one, and I don't mind selling this. What I typically do with clients is I'll sell them this whole thing. I'll just make a PDF of this. You know, I'll print it, and I'll send it to them. You know, because I'm not afraid to show them all the plans. Now, you can actually sit here and take out certain plans if you don't want them to see it. If I want to remove WellCare because I don't represent it, and I want to remove, I kind of feel like I'm being disingenuous by not showing them all the plans then. You know, but maybe I want to show the ones that I represent. You can do that. You can go through here and take out the ones you don't want to have in there. Okay, same with MedSup, same with that. And if I go back to MedSup, again, I'm going to wrap up here soon. I didn't mean this to go much more than a half hour, but so if I go into MedSups again, if I want to Medicare Supplement, just put that 17112. Okay, quote. So if you find on here, if I go to, well, where's Mutual Omaha or Aetna? Okay, if you'll notice here, this little, the rest of them don't say apply now, but I'm licensed in Pennsylvania with Aetna Continental. I'm also licensed with Mutual Omaha. Where's that one? This is Plan F, isn't it? Yeah, Mutual is never competitive in Plan F. Let's do the heck of it. Let's just let's go to Plan G here. So basically, if you are licensed in the state and the carrier on CSG here, you're able to go ahead and enroll them. Then once they decide they want to go with, say, Southern Guarantee or Limico or well, they want to go with Aetna. Okay. Yeah, here's that $100.08. I can apply it right here. Where was Mutual? It should say apply now. AARP, I'm actually set up in there. That one's not showing up, but it should. I'm set up with that one. I'm set up with Cigna. I just haven't added the state of Pennsylvania yet. And here is Mutual Omaha. Again, apply now. So you'll see that tab there if you're set up to sell those. And so this is kind of nice because you'll know that when you do Medicare Supplement work, you know, every carrier has their own you know, format, their own. So I just like to use one place to kind of enter all my stuff. So for MedSups, I try to enroll them on this site itself. After I shop with them, I am appointed with that. And so I have to put my national producer number in there. Then essentially I'm going to go into an EAP format. Okay, it's going to ask me for the client's name, Medicare number, you know, if they're just entering Medicare, if it's guaranteed issue, if it's full underwriting, and I go ahead and I go in there and we can enter that an e-application that way. Okay. So last one here is Medicare Center. What do I use this for? I use Medicare Center to enter any Medicare Advantage or Part D plans. Okay, I don't use it to shop. I've already shopped based on Medicare.gov and CSG Actuarial. I just know that I want to enroll in that Aetna RX Select plan. So I'm going to go in here. I'm just going to, go ahead and enter that plan. So if I want to do it, I'm going to start a consultation, and I'll enter in my client's information, date of all this stuff. When I go on, I'll move on. It'll ask me if I want to submit a Part D plan. It'll do the SOA for me. I'll put their health care information in there. I can actually just do a drug and pharmacy comparison plan there and compare it. But enter their age, anything about their health. I can send them an SOA, and I can enroll them. So as I go through this, I'm not going to bore you with the actual enrolling. It'll take me to Aetna's Part D plan, and I can enter the Part D there. And it does keep them all. If you'll notice on my dashboard here, I've done, I don't know, 24 here this year. Like I don't sell regular anymore, so I don't have a ton of stuff in there. But it's going to tell me here that I've done 24 plans this year, and I can look at those plans. I've done 17 PDPs and 7 MAPDs. I just find that for my Part D drug plans and my Medicare Advantage plans, it's nice instead of having to go to each individual website, I can just do them all right in here. And same with CSG for my Medicare Supplement e-applications. I have one place that I can enter numerous carriers on the same place. So for MedSup, so let me just wrap this up here as kind of a summary. Okay. So on our website, we have these tools, and I think these 3 tools are very important that you get to know. Okay. Medicare.gov. This is, again, this way I'm not using some tool they have. This is something they can go to. They can register themselves in Medicare.gov. They can do everything that I'm doing on this site, Medicare.gov. And I would suggest that you get to know Medicare.gov because it's a great website. It's a great resource for so many things about Medicare. They can find out. They can research. But what I showed you, of course, is we can find a drug plan. We can enter their actual prescriptions, their zip code, where they go to the pharmacy, and I can have an educated, an accurate printout of which plan should work out better for them. And so I know what drug plan to use. Then I go to CSG Actuarial and I shop the MedSup stuff. I also shop the Medicare Advantage plans and the Part D plans. I look at the prices for all of them so I kind of know what I'm looking at. If I want to enroll someone then in either a MedSup, I stay with CSG. If I want to enroll them in a Part D or a Medicare Advantage plans, I go to the Medicare Center. You can find these tools, remember, on our website. We have a snapshot of that. So here's GoldenCare's website. You go to Tools, CSG Actuarial, Medicare Center. CSG, I enroll my MedSups. Medicare Center, I enroll my Part D and my Medicare Advantage plans. And if you want to do paper apps or use each carrier's individual one, that's okay too. You can just use these tools to shop. But I promise you, just in my experience, and I don't sell a ton anymore. I probably write as few as 50 Medicare plans a year. What a great tool to be able to show them all the rates. If you're someone who joins screens with people, I just take them right to these sites. I'm just educating people as to what's available. I'm not necessarily trying to steer them one way. I explain the difference between the plans. I show them the price of the plans, and I ask them which ones they like. They maybe already have they like Aetna. They just have had good luck with it. Maybe they really like Mutual Omaha. The price. I show them the prices. I show them the plans. I shop them around. I can tell them everything they need. If I want to enroll, I can even do it on both those sites. If I need to look up to see if maybe they are enrolled in Part B yet, I can go to Medicare.gov and help them kind of find that out. And so between those 3 tools, you have access to plenty of stuff. So again, Medicare.gov, CSG Actuarial, Medicare Center. Medicare.gov, anyone can use. You don't need to go to a website. Just type in that Medicare.gov and away you go. So that's right here, the Medicare.gov. Now I'll go back to home screen here. CSG, or Medicare Center, this is the dashboard for my particular one, but you can go ahead and just go to the site, set up your own dashboard, set up your own center here. It's a great way to go ahead and you can shop here. You can actually shop the drug plans here too, but I do all my shopping on CSG Actuarial. That's kind of where I started. So I go to CSG and whether it's going to be a Medicare Supplement, Medicare Advantage, or PDP, I can shop all the plans here. Okay. Then if I want to do a Med Supp enrollment, I can actually enroll there. But if I found a good Medicare Advantage plan I want on CSG, I then go to Medicare Center and I enter here to enter electronically. So again, these tools are available to the GoldenCare agents. I would suggest just hop on our website, GoldenCareAgent.com. Familiarizing yourself with them, just go in there and play around with them a little bit. It will help you in your enrollment season or in Medicare sales going forward. I'm a big believer in just showing people all the plans that are out there. If they want to buy something from a C-rated or B-rated company that's $1 or less a month, frankly speaking, if that's how the client thinks, those are going to be hard clients to keep anyways. I don't mind showing them all the plans and selling on quality. Say, I represent United Healthcare, Mutual Omaha, Cigna, Aetna, Aetna Continental. I do Transamerica. I stay with like the top 10 A-rated companies. And between those 10, they're usually one of them is going to be in the top 5 as far as price. And so if there's some company I've never heard of that's $3 less a month and that's what they really want to do, I typically don't want that client anyways. The client doesn't understand that carrier could probably raise their rates miserably through the next 3 or 4 years, and they have a stroke, they can't do anything to change it. So I don't align myself with the small fly-by-night companies, and so I think most people understand that as you're selling them. So I like just being honest. I tell them everything that's available. I show them all the plans, and I tell them the ones that I represent. I represent most of the good ones, and so that's just kind of my selling style. I'm not saying it's right, wrong, or indifferent, but I just want to share with you all the tools that you have available to you. And at this point, I'm just going to open up the questions. It's kind of really all we had. It's just kind of a brainchild of being Medicare starting, the season starting soon. We wanted just to kind of have something that shows people the tools that we have to help them with their Medicare clients and needs. So with that, I'm going to go ahead and see if there's any questions to read. Let's see what we got here. Nope. Okay. Looks like I didn't lose too many of you, so it looks like I didn't bore the pants off you guys. I sure appreciate you coming on board. I hope you learned something from today's webinar. If you do have some Medicare clients questions, you may just want to bounce a case off us and show you some how these tools work more in detail. Give us a call here at the marketing office. It's 800-842-7799. That number is right here, actually. I'll leave that on here for a little bit. And I want to thank you sincerely for coming on board today just to learn a little bit about some of the tools we have. My name is Jeff Clark again. I've been a regional director here at GoldenCare for about 15 years. I've been doing insurance, Medicare plans, and long-term care for about 22 years. I'm one of the directors here, so I'm happy to answer any questions you have, or Jen and John Randall and Jen Felton can also answer your questions, or any of the marketers we have here. So again, sincere thank you for coming on board today, and good luck selling this fall, and let us help you. Thank you.